What if the food sitting in your kitchen right now, food you've been eating for decades, food you might even think is healthy, is quietly working against your body every single day? Not in a way you can feel immediately, not in a way that shows up on your face or knocks you off your feet, but deep inside, at the cellular level, in your joints, in your arteries, in your brain. What if that food is the reason your body feels older than it should? Today, I need to talk to you about something that most doctors never get enough time to explain in a 15-minute appointment. And it's something that could be affecting your memory, your heart, your joints, and your energy every single day, without you ever connecting the dots. I'm going to reveal 3 foods that secretly feed inflammation in people over 60. And I want to be very clear about something before we begin. These are not obvious foods. These are not foods you already know to avoid. Some of them are foods that have been marketed for years as perfectly fine, even beneficial. That's exactly why they're so dangerous. Stay with me, because by the time we reach number 1, I think you're going to look at your kitchen very differently. My name is Dr. Patricia Voss. I spent 28 years as an internal medicine physician and inflammation specialist, working with older adults at a major clinical center in the United States. Over those nearly 3 decades, I watched the same patterns repeat themselves over and over again. Patients in their 60s, 70s, and 80s struggling with joint pain, brain fog, fatigue, high blood pressure, and worsening heart disease. And very often, a significant part of the problem was sitting right on their plate. I want to ask you something before we go further. How old are you? And do you deal with joint pain, fatigue, memory issues, or any kind of chronic condition that just doesn't seem to get better no matter what you try? Leave a comment below. Tell me what you're dealing with, because you are not alone, and what you're about to learn may finally give you some of the answers you've been looking for. Let's start with what inflammation actually is, because I want you to understand this clearly. Inflammation is not always the enemy. In the short term, it is your body's most powerful defense system. When you cut your finger, inflammation rushes in, bringing immune cells to fight infection and begin healing. That's a good thing. But chronic inflammation, the kind that quietly burns at a low level day after day, week after week, year after year, is something entirely different. Chronic inflammation is like a fire that never gets fully put out. It smolders. And over time, that smoldering causes damage to tissues, blood vessels, nerves, and organs. It accelerates aging. It raises the risk of heart disease, stroke, dementia, type 2 diabetes, cancer, and kidney disease. And here is what most people over 60 don't realize. Your immune system changes as you age. The scientific term for this is inflammaging, a combination of the words inflammation and aging. As we get older, the body tends to produce more inflammatory chemicals even when there is no infection or injury to fight. The baseline level of inflammation rises. The immune system becomes less precise and more reactive. This means that certain foods your body might have tolerated reasonably well in your 40s and 50s, can have a significantly more powerful inflammatory effect after age 60. The same trigger, a bigger fire. Now, let's talk about the 3 foods that are quietly feeding that fire. And I promise you, at least one of these is going to surprise you. We begin with number 3, and this one catches almost every patient I've ever worked with completely off guard: vegetable oils. Specifically, the refined vegetable oils that have become the backbone of modern cooking and processed food over the past 50 years. Canola oil, corn oil, soybean oil, sunflower oil, safflower oil, cottonseed oil. Now, I can already hear some of you saying, but aren't those heart healthy? Haven't we been told for decades that these oils are better for us than butter or animal fat? Yes, you have been told that, and that message caused enormous harm. Here is what you were not told. These oils are extraordinarily high in a type of fat called omega-6 polyunsaturated fatty acids. Omega-6 fats are not inherently evil. Your body needs some of them. But here is where the problem lives. The human body is designed to function best when omega-6 and omega-3 fatty acids are consumed in a ratio somewhere close to 4:1, or even lower. In our ancestors' diets, this balance was natural and maintained. Today, the average American consumes omega-6 and omega-3 fats in a ratio closer to 20:1. Some estimates put it even higher. And the primary driver of this catastrophic imbalance is the explosion in refined vegetable oil consumption since the 1960s. Why does this ratio matter so much? Because omega-6 fatty acids, when consumed in excess, are converted by the body into pro-inflammatory compounds, molecules that actively signal inflammation throughout the body. The more omega-6 you consume relative to omega-3, the louder that inflammatory signal becomes. And there's another layer to this problem that is even more troubling. These refined oils are extracted using extremely high heat and chemical solvents. That process damages the fat molecules. The damaged fats, called oxidized lipids, are themselves directly inflammatory. They damage the lining of blood vessels. They promote the formation of arterial plaque. They have been associated in research with accelerated cognitive decline and increased cardiovascular risk in older adults. A 2020 review published in the journal Nutrients found that excessive linoleic acid, the primary omega-6 fat in these oils, promoted systemic inflammation and was associated with elevated markers of cardiovascular and metabolic disease in aging populations. Now let me introduce you to someone I'll call Raymond. Raymond was 69, a retired contractor from Florida. He was proud of the fact that he had switched from butter to vegetable oil years ago because his doctor told him it was better for his heart. He used it for everything: frying eggs, sautéing vegetables, baking. He even used store-bought salad dressings made with soybean oil. When Raymond came to see me, he was struggling with joint pain in both knees and hands, persistent fatigue, and mildly elevated blood pressure that wasn't responding well to medication. His inflammatory markers, specifically a blood test called CRP, or C-reactive protein, were elevated. We walked through his diet together. Raymond was genuinely shocked when I explained what the vegetable oils were doing. He told me, "I thought I was doing everything right." Over the following months, Raymond made a focused switch. He replaced his vegetable oils with extra virgin olive oil for low-heat cooking and small amounts of butter or coconut oil for higher-heat cooking. He began eating more oily fish, sardines, salmon, mackerel, to bring his omega-3 levels up. 6 months later, his CRP had dropped meaningfully. His joint pain had improved. He told me he felt like someone had turned the volume down on the inflammation in his body. Raymond's change was not dramatic or complicated, but it was powerful. Here is what I want you to take away from this. Look at the oils in your kitchen. Look at the ingredient lists on your salad dressings, your store-bought sauces, your packaged snacks, your crackers. If you see soybean oil, corn oil, canola oil, sunflower oil, or cottonseed oil, those products are flooding your body with pro-inflammatory omega-6 fats every single day. Where you can, replace them. Choose extra virgin olive oil. Choose avocados. Choose fatty fish. These are the fats that calm inflammation rather than feed it. But hold on, because what I'm about to share next is something that blindsides even health-conscious people. Don't go anywhere. Number 2, and this one is going to make many of you look at your morning routine very differently. Fruit juice. And other foods and drinks with a high glycemic load, including white bread, white rice, instant oatmeal, and certain breakfast cereals, that cause rapid spikes in blood sugar. Wait, fruit juice? The thing people drink when they're sick? The thing marketed as vitamins and health and brightness and energy? Yes, exactly that. Here's the reality. When you eat a whole piece of fruit, your body receives fiber, water, vitamins, minerals, and natural sugars, all bundled together. The fiber slows down the absorption of the sugar. The blood sugar rises gently. The insulin response is measured. The body handles it well. When you drink fruit juice, even 100% natural, no sugar-added fruit juice, you have stripped away almost all of the fiber. What you are left with is essentially a concentrated delivery of fructose and glucose, rushing into your bloodstream with very little to slow it down. The result is a sharp, rapid blood sugar spike. And here is where inflammation enters the picture. Every time blood sugar spikes sharply, the body responds with a surge of insulin to bring those levels back down. In younger, metabolically healthy individuals, this process is relatively efficient. But in adults over 60, insulin sensitivity is often reduced, meaning the body has to produce more insulin to do the same job. This state, called insulin resistance, is extraordinarily common in older adults and is itself a major driver of systemic inflammation. The blood sugar spike also triggers the production of advanced glycation end products. Scientists call them AGEs, which is fitting. These molecules form when excess sugar bonds to proteins and fats in the body. AGEs damage tissues, stiffen blood vessels, promote arterial plaque, accelerate brain aging, and drive up inflammatory markers. Every sharp blood sugar spike is a wave of AGE production sweeping through the body. Research published in the American Journal of Clinical Nutrition showed that diets with a high glycemic load, meaning diets that repeatedly spike blood sugar, were associated with significantly elevated levels of inflammatory markers including CRP, interleukin-6, and tumor necrosis factor alpha in adults over 60. These are not obscure measures. These are the biological fingerprints of chronic inflammation. Let me tell you about a woman I'll call June. June was 73, a retired schoolteacher from North Carolina. She was careful about her diet, or so she believed. Every morning she had a glass of orange juice, a bowl of instant oatmeal with honey, and a slice of whole wheat toast. She thought she was eating well. June came to see me because her arthritis had worsened significantly over the previous year, and she was experiencing increasing brain fog that frightened her. Her fasting blood sugar was borderline. Her inflammatory markers were elevated. When I reviewed her morning routine with her, she looked at me with genuine disbelief. "But that's a healthy breakfast," she said. "That's what I've always been told." I explained to her what was happening every morning inside her body. The juice spiking her blood sugar. The instant oatmeal, despite the healthy reputation, hitting the bloodstream nearly as fast as table sugar because of how highly processed it is. The toast adding another glycemic surge. Every morning, June was starting her day by lighting an inflammatory fire. We rebuilt her breakfast together. Whole eggs with vegetables. Berries, whole, not juiced, with full-fat plain Greek yogurt. Steel-cut oats occasionally, not instant. Water with lemon instead of juice. Within 3 months, June noticed her mental clarity improving. Her joints felt better. She told me, "I feel like the fog is starting to lift." This is what blood sugar management looks like as a tool against inflammation. Not as a concern only for diabetics, but as a daily practice for every person over 60 who wants to protect their brain, their heart, and their joints. I want you to think about your own morning. What does it look like? Are there hidden sugar spikes in your routine that you've never connected to how you feel by mid-afternoon? Keep that question in mind. Because number one, the food I'm about to reveal connects to it in a way that is going to make everything click together. Number one is the food that I believe causes the most widespread, underestimated, invisible inflammatory damage in adults over 60. And in all my years of practice, this is the one that generates the most disbelief when I bring it up. Number one, ultra-processed foods containing refined wheat flour and industrial additives. And I want to be very specific about a hidden category within this group that most people completely overlook. I'm talking about foods that contain emulsifiers, artificial preservatives, flavor enhancers, and refined carbohydrates in combination. The products I'm specifically focusing on include packaged crackers, certain breakfast cereals, commercially baked goods, flavored chips, packaged soups, boxed pasta meals, and, this is the one that shocks people the most, many foods marketed specifically as low-fat, diet, or heart-healthy. Let me explain what is happening. These ultra-processed foods cause inflammation through not one mechanism, but multiple simultaneous mechanisms. And when those mechanisms act together in a body over 60, the effect is amplified significantly. First, the refined flour. Wheat flour that has been stripped of its germ and bran behaves almost identically to sugar in the body, causing rapid blood sugar spikes and all the inflammatory cascades we discussed a moment ago. This refined flour makes up the base of a staggering number of packaged and convenience foods. Second, the emulsifiers. This is the part that almost no one is talking about, and it is the part that I find most alarming. Emulsifiers are chemical additives used to give processed foods their smooth, consistent texture. They keep oil and water blended. They extend shelf life. They're in almost everything packaged. Common ones include carrageenan, carboxymethylcellulose, polysorbate 80, and lecithin in its industrial forms. Research published in the journal Nature, one of the most prestigious scientific journals in the world, found that dietary emulsifiers, even at doses considered acceptable, significantly disrupted the gut microbiome in ways that promoted intestinal inflammation. The gut lining became more permeable, what researchers sometimes call leaky gut, allowing bacterial fragments and inflammatory molecules to seep into the bloodstream. This triggers a systemic inflammatory response that affects the joints, the brain, the cardiovascular system, and virtually every organ in the body. And here is why this is especially dangerous after age 60. The gut microbiome naturally becomes less diverse as we age. The gut lining becomes more vulnerable. The immune system in the gut, which accounts for approximately 70% of your entire immune system, becomes less regulated. This means that the same emulsifiers which a younger gut might tolerate with less disruption can cause a significantly more powerful inflammatory response in an aging gut. Third, and this is what makes the diet and heart-healthy products particularly harmful, many low-fat processed foods compensate for the removal of fat by adding more refined sugar, refined flour, and industrial additives to maintain flavor and texture. They taste lighter, but they are often more inflammatory than their full-fat counterparts. A major study from the PrediMed research group in Europe followed thousands of older adults and found that higher consumption of ultra-processed foods was independently associated with elevated CRP, elevated IL-6, and significantly higher risk of cardiovascular events, even after controlling for overall caloric intake. It was not simply about eating too much, it was about the specific inflammatory nature of what was being eaten. Now I want to tell you about someone I'll call Eleanor. Eleanor was 77 years old. She lived alone in a small house in Michigan. She was sharp, funny, deeply proud of her independence, but she had been struggling for 3 years with worsening memory, debilitating joint pain, and a heart condition that required 3 medications to manage. Eleanor was not a careless eater. She watched her portions. She avoided obvious junk food. She bought crackers that said whole grain on the label. She ate packaged soups because they were easy to prepare alone. She kept low-fat yogurt, reduced-fat crackers, and diet-friendly cookies in her kitchen because she had been watching her weight for 40 years. When her daughter brought her to see me, we did a thorough dietary review. Eleanor's inflammatory markers were among the highest I had seen for someone with her caloric intake. On the surface, her diet looked moderate and reasonable, but when we looked closely at what was actually in her food, the emulsifiers in her crackers, the refined flour spiking her blood sugar 4 times a day, the carrageenan in her low-fat dairy alternatives, we found an invisible inflammatory storm happening every single day. Eleanor was devastated. She told me through tears, "I thought I was taking care of myself." She was trying, with everything she knew, and that is not her fault. This information is buried in ingredient lists using names most people can't pronounce, hidden behind marketing claims designed to make us feel safe. We made changes together, slowly and carefully. We replaced her packaged crackers with raw nuts and whole fruit. We switched her packaged soups to homemade broth-based soups with fresh vegetables. We replaced her low-fat dairy products with small amounts of full-fat, plain, minimally processed alternatives. We focused on whole foods, real foods with short ingredient lists or no ingredient lists at all. 3 months later, Eleanor's daughter called me. She told me her mother was sharper, funnier, more present in conversation. Eleanor herself told me that the fog she had been living inside for 3 years had begun, slowly but unmistakably, to clear. "I feel like I'm coming back," she said. I will never forget those words. I feel like I'm coming back. That is what reducing chronic inflammation can do for a body that has been drowning in it. It is not a miracle. It is biology. It is the body doing what it was designed to do when it is finally given the chance. Let me bring this all together for you now. 3 foods, or categories of foods, that are secretly feeding inflammation in your body every single day after age 60. Refined vegetable oils, canola, corn, soybean, sunflower, flooding your body with excess omega-6 fats that tip the balance toward inflammation and oxidative damage in your arteries, joints, and brain. High glycemic foods, fruit juice, instant oatmeal, white bread, white rice, causing repeated blood sugar spikes that trigger insulin resistance, produce tissue-damaging AGEs, and elevate inflammatory markers throughout the body. And ultra-processed foods containing refined flour, emulsifiers, and industrial additives, silently disrupting your gut microbiome, permeabilizing your intestinal lining, and sending waves of inflammatory signals into your bloodstream every time you eat them. These are not small effects. Over months and years, this inflammation is directly contributing to the joint pain, the brain fog, the fatigue, the blood pressure problems, the heart disease risk, and the cognitive decline that so many people over 60 accept as inevitable. They are not inevitable. They are, in many cases, driven by what we eat, and they can be meaningfully reversed by changing what we eat. I want to be honest with you. I am not asking you to be perfect. I am not asking you to throw away everything in your kitchen tomorrow. Change is most powerful and most lasting when it is gradual, sustainable, and built on understanding rather than fear. But I am asking you to look, to read labels, to notice, to ask, what is actually in this food? And is it working for my body or against it? Because at 60, 70, 75 years old, every bite matters a little more than it used to. Your gut is more vulnerable. Your inflammatory baseline is higher. Your body needs more support, not less. And the good news, the real, genuine, evidence-based good news, is that the body responds, sometimes remarkably quickly. Inflammatory markers can drop within weeks of dietary change. Joint pain can ease. Mental clarity can return. Energy can lift. The body wants to heal. It is always trying to heal. Our job is simply to stop getting in its way. Before you go, I want to hear from you. Was there anything on this list that surprised you? Have you noticed a connection between certain foods and how you feel, your joints, your energy, your mental sharpness? Leave a comment. Share your story. You never know who you might help. And please, share this video with someone you care about. A partner, a sibling, a friend. Someone who has been struggling with pain or fatigue or brain fog and doesn't know why. This information can change how they feel every single day. If you want to keep learning how to protect your body, your brain, and your independence as you age, with clear, honest, medically grounded guidance, please subscribe. I am here every week with information that belongs to you. You deserve to feel well. You deserve to have the energy, the clarity, and the comfort to live fully, at every age. Take care of yourself. I'll see you in the next one.